Good afternoon. This is Dr. Anna Dolopo. I am going to talk about pain today. If you'd like to check out my work, go to elementsinharmonyacupuncture.com. This video is going to talk about why it takes so much time to heal. If you go on my website, you'll see there are quite a few Yelp reviews and Google reviews on, wow, they saw me, they saw Dr. Anna, and within a few treatments, the pain was gone. And they're so happy. And then there's some patients where it takes longer, 30, 50, 80 or more treatments. And I'm going to talk about that today because there are many people who have excruciating pain. They're seeing a pain management doctor. They have different medical doctors on their team. They're on some heavy medications for pain, muscle relaxants, neurological pain. They're taking NSAIDs. They're having to play with the painkillers. Modify the different. Switch around with the different painkillers just to get some relief. So why is it that some people heal much faster than others? Well, you can give me 50 people, and I've treated at least 1,000 over the last 26 years of, let's say, back pain or sciatic pain. When a person does acupuncture correctly, you're giving a tailored treatment to the person. Now, if you go on my website, all of those testimonials, or at least 99% of them, are based on Dr. Tan's balance method, acupuncture. So I did traditional Chinese medicine, which has been around since 1959. I did that as an intern in the 1990s and also from 1999 to 2006. March 6, 2006 until now, and today is August 9, 99% of those treatments were used or were healed or significantly improved with Dr. Tan's balance method. I have made at least 6 accountability videos. That's how to hold my work accountable. I did an expectations video and I did a momentum video. All of this explaining that you really need to come in as aggressively as possible. I had an acute injury. I had an injury last year and I hadn't hurt my knee from a jiu-jitsu injury since 2013. So it had been about 12 years since I had this kind of injury. I treated myself every day, and that improvement that I experienced by the end of the week was, I want to say, between 95 to 99%. Because what I did not want was to have this pain lingering for months and months and months. Now, I was gentle with it. I, took care of myself. I didn't roll with anyone for a while. I was very gingerly with my knee because I want to protect my knees and I would like to keep my knees for as long as possible. I've seen people hurt themselves grappling or doing any other kind of sport, and then they go and they get whatever Western medical therapy for their knee, and then they're out for like 6 months to a year, and they have a new knee. Both times with my knee, in 2013, a year after I started jiu-jitsu, and last year, I was very aggressive. Now that's for an acute situation. I know what it takes to heal from chronic pain, 10 or more years. I know what it's like to have to heal. I'm expanding on just, this is what you need to do, because what the expectations video, the momentum video, and the accountability videos really talk about what you need to do. Okay, this video is to explain to you why it takes time to heal. That term, the body follows the mind follows the spirit, people understand that, but I think it's extremely elusive because the majority of people think, I don't want to talk about my past. I don't want to talk about the trauma. I don't want to talk about whatever it is that person broke my heart, or someone passed away, or I had this happen during my pregnancy. The body keeps score. I think there's a book on that. The body does keep score. The body really does follow your mind and your heart. It really does. Whatever you feel here is going to be shared physically. It just is. There's no, if you're holding on to pain, the emotional pain, it's gonna come out in some kind of, internal health issue, some kind of severe health issue. I don't want to name anything here, but name it and it probably will exemplify. It will probably be expressed that way. I'm going to go through some of my cases. This is going to be a lengthy video. So if you want a concise, just tell me what to do, go to the momentum video. Everyone gets that video the moment I schedule them, or if one of my interns schedule them. Everything is explained, but it's very hard for people to really believe that they're the ones who have to take more than 20 treatments. That's the beginning phase for chronic issues. Okay, so I share these links with people, but I think in this video, I'm really going to break down what it takes to heal. I hand deliver a lot of these cases to the majority of you during our private sessions. What you decide to do with it is up to you. If there are many people who write down in their paperwork, I want to treat the root of the problem. Do you? Because I know what it takes to heal. I personally know. In 1994 to 1996, I healed a lot of my health issues. The weight issues, depression, anxiety, skin, menstrual health, precancerous issues. My bones used to crack a lot. 20 years old and I'm 51 now. I'm stronger now than I was at 20. I'm way stronger and I'm way healthier. I was told I may not have kids. There were so many. I mentioned the skin. I mentioned, the self-esteem when you're, 5 sizes overweight. Constipated, not being able to have a bowel movement more than once every 1 or 2 weeks. There were a lot of things: skin, menstrual health, precancerous stuff, the weight, trauma from my childhood. There were so many things I had to heal from. And that sounds about right. It's 2 years. I transformed my health. The hard part for many people is to actually do it, to go through it. It's easier for people to understand, well, if a person's 300 pounds and they really should be 120, of course it's going to take time. Well, it's not so easy to understand when you have had pain for a long time. That pain that you've been experiencing has become your normal, but that's not natural. Why is it not natural? I don't have pain. The majority of people I know that, they don't have pain. So why do you have this chronic migraine? Why do you have this chronic back pain? Why do you have this chronic whatever? It's not just, something mechanical. There's something going on. And until you heal that, you will be more than likely going from doctor to doctor, MRI after MRI, test after test, trying to figure out, why can't I have a bowel movement? Why do I have diarrhea every day? Why do I have back pain? Why do I constantly have these migraines? It's not so elusive to me and other practitioners of Chinese medicine and other types of holistic medicine why the body follows the mind follows the spirit. I have said that in the majority of my videos when I started making them with the older YouTube video in older YouTube channel in 2006. And until you really embrace that and really delve into, why am I doing this and what is my intention? Okay, let's say you don't remember. You could be blocking things out. People who experience sexual abuse, oftentimes, or whatever trauma, tend to hold things in because we're self-preserving. It's for self-preservation. You're trying to make it day to day. And until you really understand why, until you realize, I got to heal from things the resentment, the energy of the liver, not your liver. The energy of your liver has to do with anger, stress, resentment, pent-up emotions, controlling the emotions, and depression and more. The energy of the spleen. I'm not talking about your spleen. I'm talking about the energy of your spleen. And don't worry if you don't know What does that mean? Don't worry about that right now. The energy of the spleen has to do with overthinking, worrying. The energy of the heart has to do with joy and sadness. You may think, how is joy a bad situation? Well, if these are emotions that are being held on, not just, I'm sad. I mean, if your father passed away, but if your father passed away 10 years ago and you're still grieving, and, you know, we need to heal that pain. We need to heal because life goes on. The rest of the world doesn't care. And that's unfortunate, but we need to move on. The grieving time has to pass. And also, if you see like a transient person, a homeless person, you see someone who is on the street and they're just talking and laughing, and there's no reason for them to laugh, and they're, crazy, you know, there's an energetic situation going on with the heart. The energy of the lungs has to do with grief. The energy of the kidneys, the energy, I'm making it very clear, we're talking about the energy. And I know that word means nothing to many people because it's like, what do you mean energy? That's what we will talk about privately. The energy of the kidneys has to do with anxiety and fear. Now, there are also positive things with the liver. The energy of the liver also has to do with, I'm going to get it done. I have a friend, she's Japanese, and she said, that's like a blade of grass. They have a saying, she lives in Japan. She said, we have a saying in the Japanese culture, it's like a blade of grass that's going to grow in the cracks of a sidewalk. It's going to find a way. That's the energy of the liver. I'm going to do it no matter what. It's going to get done. That's a great trait to have. Now, the energy of the kidneys, yeah, it has to do with fear and anxiety, but also has to do with willpower. What is the difference between willpower and I'm going to get it done? We'll talk about that in private. There are so many positive things, emotional stuff with the other organs, but I just want to tell you, quote unquote, the negative stuff, so you understand if someone's been dealing with chronic resentment, chronic anger, chronic depression, or just, I'm gonna hold it in, not gonna deal with it. It's in its own little package. I don't give a SHI whatever, it's in the past. I'm not gonna deal with it. That's definitely the energy of the liver. You'll probably see joint pain. And what do you have in the spine? You have the facets, so you have all kinds of joint pain and other stuff going on with the energy of the liver. When it comes to someone who is constantly thinking, ruminating, I want to make sure everything is covered, I want to know how everything's going to go, they're probably more of a person who has energy of the spleen issues. This is a person who, I'm not going to make any moves unless I know exactly what's going on. They worry a lot, they ruminate a lot, they overthink, and there are probably some significant digestive issues, bloating, distension, especially distension also with the liver, but I won't go too much into that right now. I want to keep this as simple as possible. This is a person who has muscle issues, maybe fibromyalgia, and more. There are a lot more. I'm not going to go too much into, definitely digestive issues of every kind. The energy of the spleen and the stomach. With the liver, it's the energy of the liver and the gallbladder. With the kidneys, the energy of the kidneys, also with the energy of the bladder, that's, a different organ system. The one that has to do with anxiety, you're probably looking at spine issues, central nervous system issues, peripheral nervous system issues. Now, I know there's a huge dispute in the Chinese medical community when it comes to neurological issues, whether it's the energy of the liver, energy of the kidneys. I'm going to make it very simple here, and you're welcome to argue all you want. I'm just speaking from my own experience, having studied this since 1994, but most importantly, seeing everything applied. So there are times when, yes, I can see how it can be with the liver, but I'm going to keep it very simple, all right? Just for the benefit of this video, in case there's acupuncturists around the world watching this, the energy of the kidneys I'm going to define as central nervous system, peripheral nervous system. This person probably has knee issues, low back issues, probably premature graying of the hair, loss of hair. And we're not just talking about genetic. We're talking about, within a few days or a few weeks or a few months, they just start losing their hair. Which, by the way, if you go to my website, and I will start I'm not going to pay attention to time for this particular video in case there is someone who is really suffering and you really want to geek out and understand from an acupuncturist perspective how this works. For those of you who need to know, the DACM is Doctor of Acupuncture and Chinese Medicine. The Diploma of Oriental Medicine is I'm board certified, and the L.Ac is I'm a licensed acupuncturist. I take my work very seriously, and so I don't like to explain things too much because I'd rather just get to work. But there are so many people suffering right now, and it hurts to hear the beginning phase for easy cases is the first 10 treatments. The beginning phase for chronic issues, severe issues, is the first 20 treatments. Beginning phase. It hurts to hear that, but you need to know how this works. Hi, Anna. So this woman had hair loss, anxiety, insomnia, dizziness, migraines, and fatigue. Hi, Anna. I just wanted to say thank you for treating me for the past year. When I came to you, my body was a mess. I was dealing with symptoms from a head injury from 3 years ago. I was seeing a neurologist, psychiatrist, psychologist, and no one was really able to help me like you did. They put me on countless prescriptions, and my body rejected every single one of them. I came to you when I was at my lowest. I had no other options, and I found you on Yelp and thought I would give acupuncture a try. My symptoms were fatigue, dizziness, migraines, insomnia, anxiety, and the most recent symptom was my massive hair loss. Within 4 months, I lost about 90% of my hair. The Western doctors told me it was an autoimmune issue and nothing can really help it. Other than time, I tried steroid shots in my head and it didn't work. I started treating with you last spring, and even though you told me my hair loss would be a long and tough battle to treat, I saw results within a few months. 9 months later, not only do I have a full, thick head of hair, but my symptoms from my head injury are getting better. My sleeping has improved and my anxiety has been reduced. I can't thank you enough for your honest and diligent work. Thank you again for your magical healing and always being honest with the expectations of treatment as well. Regards, Y. And so if you go to elementsandharmonyacupuncture.com/hair loss anxiety dizziness, you will see Y's testimonial. She wrote this March 16, 2020, and I'm happy to say that she still comes in, and I see her maybe once a month, and she still has her hair. And the other symptoms are pretty much gone, and she just recently won these 2 huge trophies for golf. That's what it takes to heal. You got to put in the time, you have to put in the effort. I know this costs time, I know this costs money, and you have to understand, I keep my patients here for at least 45 minutes. Many people stay 1 to 3 hours. For example, a patient is here today. She came in at 12:20 and it is 2:38, and I am fully confident that I'm going to do this video and she's not going to yell for me to contact her because she is healing. I'm going to talk about this particular person who was on the table. She came in with severe Bell's palsy, and she started having it after a very combative situation she had. She was very distressed regarding her mom's passing, and she had to drive up to her parents' home, which is hours away, and she had to clean everything and organize everything. And she drove Friday or Thursday, worked all day Friday, worked all day Saturday, worked all day Sunday, or something like that. She had at least 2 days of organizing her parents' home after her mom passed away. And then Monday or Tuesday, she drove back. And instead of feeling appreciated, her family criticized. And she has a full-time job. She has a full-time career. And she's excellent at her career. So she was very angry, disappointed, sad, grieving. And it expressed itself in that week, immediate Bell's palsy. So she is at 75%. I'm happy to tell you that she can smile and her eyes can close quicker, and she can move her eyebrows. And she is so happy. The body follows the mind follows the spirit. I'm not just treating her physical situation, I'm treating the reason why it happened. There's a difference. Before she saw me, she did get the steroids. She did do the Western medical care, and she wasn't getting any results. Why? Because steroids don't treat the emotional root cause of the Bell's palsy. It's not like she was having a good time and she's just, and then one day there's Bell's palsy. No, no, no. She was distraught. She was in a very dark, angry place, and she had to drive home alone for hours. So she was, sitting in that emotional darkness. We need to talk about this. And when I talk to my friends who are, other types of medical providers, they say, you're like a therapist. And I'm not a licensed therapist. I'm not a psychotherapist. I'm not a psychiatrist. But this is something that we do have to talk about. And I do refer to therapists. There are at least 2 psychotherapists on my on my website. And I do refer to people who are psychologists. They're on my website. And also people who are not on my website, because I'm not a talk therapist, but I need to understand what the gravity of your pain is. Because if you can release that and you can reveal that, I know which organ systems to treat. Does that make sense? So let me just tell you how many treatments, we'll call her T, how many treatments T has had to achieve 75% improvement for an acute Bell's palsy that was not treated effectively by steroids. So she came in July 30, 31, August 1, August 2, August 4, August 5, August 6, August 7, and August 9. So 1, 2, 3, 4, 5, 6, 7, 8 treatments to get to 75% improvement, and today is her 9th treatment. This is an acute condition. She took, she said, I need to heal. And I said, well, I'm here. And she got a package, and she's going to use her package, and it's money worth spending because she doesn't even look like she has Bell's palsy anymore. I think she looks closer to 90%. In her mind, she's 75%. So I'm going to keep working until she feels at least 99+%. She is so happy, and I'm so happy for her that she can walk around. You wouldn't even know. She has been here almost every day since July 30, and it is right now August 9. And she basically has her life back. This is what we're doing when we have clear expectations and you follow the protocol. Other acupuncturist protocol, I hope, are similar to mine. The difference, I would say, is the length of time on my table. I've worked at clinics where they've convinced me you need to have the needles in for 20 to 30 minutes. I can tell you, I don't care what the research says. I see what I have been doing since 1999, and I'm going to do exactly the way Dr. Tan, who in my opinion is the most successful acupuncturist that I've ever seen on the entire planet. And there are a lot of great masters out there and grandmasters. And I do things the way Dr. Tan taught me, Dr. Richard Tefu Tan. If you want to know who my master is, he passed away. You can go to elementsinharmonyacupuncture.com and go to videos, and you'll see Dr. Richard Tefu Tan, or elementsinharmonyacupuncture.com/shifu, SHIFU, and you will see some pictures and a video of him. And if you want the password for the Vimeo video that I did for him, please feel free to text me at 619-341-4341, and I will share with you. I am doing acupuncture the way my grandmaster taught me. Okay? So I want to share, we're talking pain. There is a woman who wrote a testimonial many years ago, and her testimonial is under elementsinharmonyacupuncture.com/headaches. Now you may think, I'm not dealing with headaches. I'm dealing with pain in my body. I'm not talking about head. Now her testimonial was specifically for headaches, but she had pain from head down to her toes. She was not able to walk without a strap behind her. She couldn't wear slippers. And her shoulder blades, her shoulder was like this. We graduated her. I'm going to reverse engineer things right now. When she graduated, she was doing CrossFit. I was so happy to see that after we graduated her, she was lifting those big tires. Honestly, I thought she was going to become like a WWE fighter, performer. She was so strong. I mean, those tires are huge. And also, she was back to riding horses. She had a huge accident when she was 9 years old. And I have a little, let's see if I have a cough drop. I do not. I have a little tickle in my throat. So let's go through this because I want you to understand that I know the pain you're going through. This was a case that I treated back in 2011. It is by Gina. Go to elementsandharmonyacupuncture.com/headaches. It is right now 2025. She wrote this August 23, 2011. Before I found Anna in January of this year, I was in a lot of pain. So this was January when she found me. She wrote this in August. My first car accident, severe whiplash, no broken bones, was at 9 years old. Fast forward through some hard jars, falls, and various other injuries. In 22 years, I was suffering from debilitating headaches every other day. Upper, middle, lower back pain, hip, and foot pain. For no apparent reason, my fingers would feel like they had been slammed in a car door. My shoulders would be drastically uneven every other week. It hurt to walk for longer than 10 minutes, and my neck was so weak. I had to hold my head up when I would lean over to fill out paperwork or read, or she would have to hold it up like that. My chiropractor was sometimes seeing me 3 times a week to put everything back into place, but frequently these treatments held only 3 to 4 hours. Tomorrow will be my 75th acupuncture treatment, and I no longer see the chiropractor. I am now enjoying every morning because the headaches are not there. I'm no longer popping painkillers and living in a fog half of my waking moments. The numbness and pain in my arms and hands have left. The strength in my neck and back has increased, and my posture has improved greatly. We are still working on some lower back hip pain and a faint weakness in my feet, but I can now wear flip-flops after being trapped in shoes that could accommodate my somewhat bulky $300 foot braces for over 2 years. Anna's kind words and treatments have given me the ability to live a much fuller life. The results I found with Anna supersede all others. Since my first treatment, my pain levels have gone down around 70%. I believe I need around 20 to 50 more treatments to graduate from my pain. Just a little bit further to go until I'm pain-free, something I never thought possible before I met Anna. You cannot lift those big tires in CrossFit without being pain-free. I'm going to assume that. You know, in training jiu-jitsu, it's probably best to be pain-free. When you're doing some kind of martial art, you probably want to be pain-free. My daughters compete in dance, probably important to be pain-free. You got to be pain-free. My son just started basketball. He had his 3rd game today, or 3rd lesson today. You know, got to be pain-free. I've said in other videos, and I want to treat more Olympians. I've treated 5 Olympians, 4 of them gold medalists. 3 of the gold medalists are American, and the other one is a bronze medalist. All of them are American except 1 gold medalist. I'm going to assume you need to be pain-free or as close to it if you're going to perform at such a high level. So when I say I specialize in pain and getting rid of pain, I mean it. Like a dream job with me would be, besides my fertility aspect, would be treating, professional athletes who are constantly pushing themselves to the max because they know in order to perform at that level, you need to be as pain-free as possible. Your body needs to be fluid. Otherwise, you're just not giving your best. There's a case, I did a video on herniated disc. Please watch it. You can go to elementsandharmonyacupuncture.com slash herniated disc. And I discussed how I got that person to 95% improvement. She lived in she lives in Australia, and she was here for 4 months. And I had a goal to get her to at least 95%. She had an acupuncturist before she came to see me. She saw that person 5 times in a row. That person put needles in the area of pain. I remember this was many years ago. They made the appointment while they were on the plane coming to live here for 4 months for the husband's job and for his profession. And we treated her aggressively at least 3 or more times a week for 4 months. And my goal was to get her to 95% improvement. And I was able to find someone for her in Perth, Australia. So I felt like I accomplished what I needed to, and she did not stay 1 hour. She stayed hours. So if I don't need to go, please stay. If I don't need the table, please stay. Okay, it really does matter. I've talked about this particular case many times because it is one of my favorite cases. This is not just a migraine, but it's about migraines with brain hemorrhage. This is also a case I use as a training tool. In this particular case, she lived alone at the time with 3 dogs. And so there was no one to take care of her because it was COVID. She started with me in February, and she wrote this 11/11 that year. I'm going to go through the testimonial. She put in a lot of time, a lot of treatments, and a lot of hours per treatment here. That was a time, I have a community setting. That was a time when not a lot of people were leaving their house. I was legally able to work because I'm a primary care provider here in the state of California, and I let her stay here because people weren't trying to keep you at Costco or Target or wherever, and we really needed to be around each other, even though we were being told to not be around each other. So I put the needles in, and then I'd leave. If a person was comfortable with me having a mask, I wore a mask. And so she had long treatments, and they were very aggressive because the other option was to have surgery. That's what her neurologist told her. She switched her neurologist when she was 50% better because her neurologist told her, don't do acupuncture because it's just spa treatment. If she did the surgery, who was going to take care of her? Because no one was going to go to her house. And I did a video describing this situation, and I was very angry in the video and extremely livid. And I think I was yelling in the video because I thought that was improper for the doctor to tell her when she was 50% improved with the migraines that she should not do acupuncture. If something's working, you should do it, especially since I had a game plan. You must have a game plan. Where the treatments go wrong is when people don't follow the game plan. If you're barely going under once a week, I'm going to give you a synopsis of the momentum video, the 6 accountability videos, and the expectations videos. If you go under once a week, expect nothing. Just come in, have a good time, see if it's going to give you any relief. It's like me trying to learn Spanish or Mandarin or Arabic from you. Now, I majored in French. You got to do it every day. That's why Duolingo has you do it every day so that you remember and you learn. There's a system. If you go under once a week, don't expect anything. Have a good time, relax, stay as long as you want. Good. If you go once a week, all right, let's say a person's 70 pounds overweight. I'm going to work out once a week. Well, you will not lose your 70 pounds, or you will take a very long time unless you decide to starve yourself. Less input, more output. So if you want to lose 70 pounds and you're just going to work out once a week, good luck. Compared to the person who's going to work out 3 to 5 times a week. You're going to see much more transformation in your body and more transformation internally, emotionally, when you're able to do it more consistently than once a week or more frequently than once a week. So if you go twice a week, better. The peak of the treatment hits within 1 to 4 days. Better than once a week. The people who are seeing tremendous results here, I say 2 more times, but really 3 or more times. I want to see results happen in 2 to 6 weeks because we want to buy the next 2 to 6 weeks. Really, that's what it comes down to. If you've had severe pain or you have severe digestive issues or severe cardiovascular or lung issues or whatever, autoimmune issues, some kind of whatever you're doing. Think of it this way, if one blood pressure pill is all it takes to fix your blood pressure, then why do you have to keep it every day? Why do you have to take your type 2 diabetes medication every day? Why do you have to take metformin every day? Why do you have to take 3 blood pressure medications every day? Why do you have to take your cholesterol medication every day? Those trifecta, why do you have to do it every day for the rest of your life? You're not healing it. You're just making sure you're not going to have a stroke, or your blood pressure is not going to go haywire. Why do you have to take your thyroid medication every day? Did you think about that? I'm being as honest as possible in this video, because this is what it takes for people to really understand. If it's just mechanical, if you just tripped and you broke your knee or whatever, shattered your knee, or whatever's going on, it takes time to heal. This is natural medicine. There's nothing in the needles. Some people crack up because in some of my fertility videos, and I've done at least 100, both for natural pregnancy and fertility specialists, and for Elements in Harmony, and for my Happy Club videos, I've done at least 100. My patients would crack up, and some of my students would crack up, and I say, there's no sperm in the needles. We're reprogramming you. It takes time to reprogram. So how did I heal this person? Laura wrote this on November 11, 2020. I've been going to Anna since February. So what is that? 8 months. February, March, April, May, June, July, August, September, October, November. 9 months. But she wrote it 11/11, so more like 8+ months. I highly recommend her for acupuncture. I started seeing her because I started to have migraines one day. I never had them before. My doctor told me that sometimes that just happens, and then you just have to live with it. I did accept that. Living with migraines is not living. I would later find out that it was due to a brain hemorrhage. From that moment I met with Anna, she gave me hope that I would not have to live with it. She knew she could help, and she could see that I needed it. My eyes told the story of the pain I was living with. They had become bloodshot red from the pain. I started aggressive treatment in February, and after a few treatments, I could tell it was helping. It was like she was able to turn the dial down on the pain. It would take months before I would be migraine free, but I made it, and it was largely due to Anna's help. Once I found out the cause, she was able to adjust the treatments to consider the brain hemorrhage. The doctors were not able to do anything really except pain meds that didn't work. I don't think I would be where I am today without her help. I'm still going to Anna, and I will keep going because I have improved from her treatments, and I think she can continue to help me heal and stay healthy. Definitely go to see her for pain. Now, she was here very frequently for 8 months, specifically to treat the hemorrhage. No more hemorrhage, no more migraines. Okay? So I hope you're starting to see a trend. Getting rid of hip pain is not a big deal for me, but I'm going to explain this particular case. This woman was 90 at the time, and she lives alone. She was a 90-year-old woman. She is 91 now, and she's amazing. She lives alone, and she was using a cane. I call her Dr. B. Now, Dr. B, I treated in September, 2 years ago. I fixed it. I didn't know I fixed whatever I fixed until I didn't follow up. She was getting better. I don't follow up with all my patients, but she was happy. But then I saw her again in February, and I said, hey, Dr. B, you're using a cane now. This was a completely different issue. She goes, oh, yeah, you fixed that other issue. You need to get me off this cane. She's a very feisty woman, one of the first nurse practitioners on the planet, rides an Arabian horse. She likes, she shared her pictures. She's very proud of what she does. I'm proud of her. Living alone, 90 years old, riding an Arabian horse. Pretty powerful woman. Got her doctorate of nursing after raising 4 kids. Really powerful woman. So here's my, I did a video on it. I'll just give the synopsis. She suffered from sciatic and hip pain, 95% improvement after 8 treatments. 95% after 8, 98% after 9 treatments, 99% after 10 treatments. I treated her with Dr. Tan's balance method, which means that none of the needles went to the area of pain. She never took off her clothes. I was treating for left hip pain, sciatic pain. It was excruciating. These are my notes, a part of my notes. First treatment, February 8, February 9, February 11, February 12, fifth treatment, February 13. So February 8 to 13, she had 5 treatments, 8, 9, 10, 8, 9, 11, 12, 13. After the 5th treatment, she was back on her Arabian horse. I have a picture of her on her horse on February 13. February 14 was her 6th treatment. February 15, the patient had to be chased out. I had to chase her with her cane because she forgot her cane. I did not see her after the 7th treatment with a cane. 8th treatment, February 17. February 19 was a 9th treatment. She reported a 95% improvement. Then she went to the biggest horse show west in the Mississippi, which is the whole reason why she was coming in so aggressively. She had come in for 9 times between February 8th to February 19th. That's 11 days. I was concerned that she was going to come back with a lot of pain. For 8 years of my life, I had showed Staffordshire Bull Terriers, and it's a lot of work. One day you can be tired. She was there for a week, and she said for one of the days she walked 1 mile. No cane. So when she came back 7 days later, she reported, 8 days later, she reported a 98% improvement. It went up 3%, the improvement. Then I saw her again a week later, 99% improvement, March 4. She's a retired registered nurse and a nurse practitioner, and has her doctor of nursing. She understands medicine really well. I'm grateful for her trust. She knew that I was going to be able to treat her, no herbs, just acupuncture, not to the area of pain. And this was, she had been having it for a few months, and her daughter said, you need to go back to Anna. So then she came once a month, and by the time I was done treating her, I was no longer treating that. I was treating other things. So that is how we treat severe acute pain. I can go case after case after case, but I do want to share, for those of you who want to get pregnant naturally, go to naturalpregnancyspecialist.com. For those of you who want to get pregnant, this is what I'm able to do. I helped a couple get pregnant. Daddy had a 2% sperm count. We got it to 72%. In 2 months, 20 treatments, I got it from 2% to 42%. And in 8 more months, we got it from 42% to 72%. I did 2 videos on that. You've made it this far. This is a very, very long video. I just want to share with you that you can heal. It takes time. I want to share, I do this often. I share the stage 4 kidney condition. Stage 4 disease, stage 4 kidney disease, in 1 month and 7 days, from March 19 to April 9. Her treatments from March 3 to April 10, actually. 1 month and 7 days. We got the eGFR from 30 to 90. And so she was supposed to have dialysis, but she didn't want dialysis. The doctors were shocked. They called it they went to stage 4 kidney disease to mild stage 2. However, at the time, a GFR of 60 or higher is a normal range. A GFR below 60 may mean kidney disease. A GFR of 15 or lower may mean kidney failure. According to the National Kidney Foundation, normal results range from 90 to 120. Older people will have lower than normal GFR levels because GFR decreases with age. Normal values may vary slightly among different laboratories. So she was at a 90. We got it to a 90 in 1 month and 7 days. Just to let you know, the first 9 treatments, March 3, 5, 7, 9, 10, 12, 14, 16, 17. Those were the first 9 treatments. We did a total of 19 treatments from March 3, 2018 to April 10, 2019. That is an aggressive treatment. Those were painful treatments in the beginning. It was not comfortable. She had to be in a recliner. At the end of all those treatments, she hiked for 3 hours with a new beau she had met at the time at Whole Foods. And she was very happy. She was we'll call her Jay. Jay looked like a completely different woman. You can heal. I've done a lot of videos, and I really wanted to share in this that you can heal. It just takes time. It takes time to heal. Oh, here's another one. Um, you know, visiting all this helps me remember some of my toughest cases. These were people who really gave me a chance. And in a 26, year span, um, I've been very blessed to have people who trust me and now trust the acupuncturists who work with me. Um, and just a little plug for a massage therapist. She's a neuromuscular sports massage therapist. She works on infants, pregnant women. We've done a lot of videos on her. She has over 20 years experience. She is one of my greatest friends. I helped her have 3 babies, and we've worked together at Burke Williams since 2003. So if you want an amazing massage, please hire Nicole Davidson. Just text me at 619-341-4341. Foot Pain and Restless Leg Syndrome by Giuseppe. 5-star rating. He wrote this February 10, 2018. My gosh, 100 reviews and a solid 5-star establishment. Truth is, Anna deserves 1,000 times 1,000 5-star reviews. I've seen Anna for 3 separate issues over the last 10 years. My first encounter with her was to deal with chronic foot pain. Daily foot massages were the only relief I can find for what was accepting as a part of life. Again, that's chronic pain. The hour-long massages would only produce a couple of hours of relief, usually just enough to fall asleep. Anna's name started to circulate around the office, and each testimony made me more and more curious. Eventually, I took the information and made an appointment to get stuck with needles. Come on, that's how you think of acupuncture. As with all new clients, Anna will sit down and explain a bunch of stuff to you about insurance, care, health, nutrition, and cost. Just to let you know, we don't take insurance anymore. She's remarkably gentle, caring, and reassuring. That reassurance is a spirit of encouragement surrounded by an immense amount of confidence. With an incredible smile, she will ask you if you want to move forward. After dealing with the foot pain for decades, that's pretty chronic. Foot pain for decades. I was willing to try anything. She just made that decision a lot easier. Getting stuck with the needles was less painless than I expected. And once I experienced relief from the pain, I was eager to keep going. Each visit produced more and more relief, with the time between the foot pain's return growing further and further apart. Less pain and less need for medications or whatever in between the time frames of the pain. Eventually, the pain was completely gone, and I suspended visits to her before we completed the calculated number of visits. I became a believer in Eastern medicine. 10 years had passed since the first experience when I started to have issues with restless leg syndrome, also known as RLS. Some quick research online sent me into depression, as most reports stated that there is no cure for RLS. Recommendations for relief were all a no-go option for me. The nights of poor to no sleep were beginning to impact my days. I was again desperate for relief. Eventually, acupuncture came to mind, and I went frantically searching for that girl's information again. Eventually, I found Anna's information buried on my hard drive and texted her. Thank God she was still in business, still in Orange County, and somehow remembers me. An appointment was made, and I spent almost every other day in her office for about 2 weeks before I was 100% pain-free and satisfied. Let's review that. You can find this at elementsinharmonyacupuncture.com/foot-pain. For the second visit, the second issue, he came in every other day for 2 weeks before he was 100% pain-free. I hope you got that, because that's what it takes. And this was not chronic pain. This was becoming chronic pain because it was restless leg. That doesn't just happen. But 2 weeks, every other day. Do you know how many people are depressed or have severe emotional health issues because they can't be in a plane without sitting? They have to keep walking up and down the plane, or they can't sleep because their leg is constantly restless. It can be very, very difficult to treat, but it takes time. It takes time. You got to be here. You have to stay here, and you have to be here frequently. My third and latest experience with Anna was about a year later. I must have bruised the sole of my foot hiking or something. After waiting 3 months for the foot to heal so that I could walk normally, I decided to see Anna again. Having a better understanding of how acupuncture works by this point, I knew that stimulating the nerves would accelerate the healing process. This injury seemed to be a bit more stubborn to heal. Listen to this part. The sessions were long, more frequent, and more than expected before the last 20% of pain dissipated. The sessions were long, more frequent, and more than expected before the last 20% of pain dissipated. It's like the last 5-10 pounds to lose. Anna and acupuncture is 3 for 3 in my book. That's 3 more success stories than I ever got from modern medicine and or doctors. I hope this testimony, along with the hundreds of others before me, encourages you to give Anna a call. I want to share that I have over 300 Yelp reviews, but 238 or something like that are showing. So if a person writes a Yelp and they don't have a lot of reviews, they get taken off. If you would like to share anything, please feel free to also write them on Google, because I have like 27 or 23 or something. So if you would like to help me out, because I do want to help as many people. I want to help thousands of people, thousands and thousands of people. I've already helped thousands of people, but I would love to help 100,000 people in my lifetime. In conjunction with the other doctors, I'd like to help 500,000 people because Chinese medicine does work. So here are my notes from this particular case. This review brings me to tears. To say that I am very appreciative of my patients is an understatement. I'm very grateful that I chose this field. I am very grateful that I stuck it out even when the going got tough, which it did many times. At the time, I was in practice for 19 years. It seems like the last 19 years just flew by, and it may seem to readers that since I have a lot of Yelps and testimonials on my website, that this medicine must have come easily for me. I must have always kept my faith. I must have always believed in this medicine. I'll just say here in a nutshell, it was not easy. I lost my faith a few times. I fell a few times. I was disheartened more than I can count. I never thought I could make a living with Chinese medicine, but here I am. Believe in your dreams, they do come true. My greatest gratitude to everyone who has ever believed in me, and has given me a chance to stick you with acupuncture needles and share a few words of wisdom. Above all, I am thankful to my family and mentors who see greatness in me, even when I ever doubted myself. So right now, there are some really tough cases, and that's my younger me, 7 years ago, 6 years ago, speaking to me right now. So I implore you to keep your faith. What's your option? Your option is painkillers. And how long are you going to do that? To take a painkiller for a week, 2 weeks, maybe a month is one thing, but when you got to live on it, that's not living. If you have to be on a medication to stay alive or to be on a medication to, be pain-free, that's got to be something that you are at peace with. But if I can help you, not just take the medication to stay alive, but to thrive. Let's say you do need to take the medication in order for your heart to keep beating, or to not have AFib, or to not have a heart attack. Do what you got to do. But I honestly believe, and this can be a great in conjunction medicine. But when it comes to pain, if I can get you to 80 to 99% improve, maybe not graduate you, but even if you're 50% better, I think you'll be happy. This is my third website, Elements in Harmony, Acupuncture.com. I had for many years MoveYourChi.com. I had hundreds and hundreds of videos, and I just could not transfer them all, and they were not all on Yelp. And I just had to one day stop paying that website and just say, I'm just going to have to earn more. There were a lot of Yelps, a lot of testimonials, and a lot of Yelps that I didn't transfer over just because, I just didn't have the time. I mean, I have to focus here. But I just want to let you know that if you think you can't heal, that's not true. I have a serious pain case right now, and she came in. She's very fortunate that she found out from her doctor that it's not cancer because there's a severe issue going on. And but I will say this: one of the things, she's only had 1, 2, 3, 4, 5, 6, 7. Today's her 8th treatment. And after 7 treatments, she has no more menstrual pain. She has no more cramping. She said, and it's like 2 days of, light flow, and then 3rd and 4th day are heavier flow, and then the 5th and 6th day are just spotting. And she has no more cramping. That's after only 7 treatments. Do you understand? Like, and she said it's more regular now. She can predict. The beginning phase for chronic issues is the first 20 treatments. So when are her treatment dates? July 5, July 7, July 11, July 15, July 17, July 24, July 25, and today's August 9. So just that, she's becoming more natural. I want you to know that living pain-free is natural. Living with pain is become your normal, but it's not natural. So I've done a lot of videos. This one was not going to be short and sweet. I explained that I wasn't going to. You'd be surprised what acupuncture can do. You'd be surprised what your body can do. Your body can heal. All right. I hope you have a great day. Please text us 619-341-4341. One of my interns or I will respond as soon as possible. You can also call 949-305-1703. It is my office landline. My kids, I have 3. The first 2, the 21-year-old and 15-year-old, don't know what this is. It's called a phone, and it's cordless, and it works. All you do is press it, you dial the number, and then it calls the person. And there's a reason why I have a landline here at the office, so people know that I live in that my practice in Orange County. When you text 619-341-4341, I'm actually here in Orange County. Okay, my fertility program is worldwide. I have a 91+% success rate. If you want to get pregnant, please go to naturalpregnancyspecialist.com and check out the video there, and contact our natural pregnancy liaison specialist. If you cannot make an appointment online, go to 619-341-4341. Text that number, and I will get you in communication with our natural pregnancy liaison, and we'll help you get pregnant. It's a 3-month program, and it is not pay as you go, and you will enjoy your investment. I promise you. I had my 3rd baby at 43. It was a surprise. My periods were perfect. I was doing the natural pregnancy, the natural method, and he was not over 9 pounds. So I am a product of my teaching. All right, you guys, have a great day. You can heal.